Patient safety initiatives and measures have been formulated at international, national, and local levels by various individuals in support of medical errors reduction and safer care. In June 2008, a patient safety improvement collaborative program was initiated between Chester Hospital in the United Kingdom and Chisizi, a missionary hospital in Uganda under the supervision of the World Health Organization African Partnerships for Patient Safety, to serve as a focal point for patient safety in Uganda, from which national and UPMB health facilities will learn.
There have been a number of definitions of quality rising from manufacturing industry and little known in healthcare. Quality generally can be defined as degree of excellence.
UPMB seeks to engage Uganda government hospitals in patient safety and quality improvement programs to offer affordable, creative, sustainable, and innovative patient safety solutions.
In order to ensure patient safety in any hospital or healthcare setting, we need to consider a few things. We must consider latent failures, which are due to organization and management culture, and these are about management decision making and organization process. For example, if a hospital decided not to buy gloves, then that could cause problem in another area. You would find clinicians actually working with patients without gloves, or working with patients on the same gloves, which could actually spread the infection. But also, there are contributory factors which influence practice. To do things like a working environment which is not supportive, team factors where people actually don't share information, individual factors which could be lack of training or incompetence, task factors which people taking on tasks which are difficult beyond their competence, and then it ends up in errors.
Mengo and Cure Hospitals are private not-for-profit hospitals supported by Uganda Protestant Medical Bureau. Both hospitals have a vision to become centers of excellence for quality and patient safety, holistic healthcare, medical education, and research.
The unique thing about Cure, we are a charity hospital, and yet we're providing some of the highest quality care in all of East Africa. In fact, maybe even in the continent. We're doing brain surgery, about 110 to 120 brain surgeries a month. This question about having high standards of safety and providing the best health care possible, it comes from the pursuit of excellence. We think that every life is a precious gift, and we want to do everything we can to make life better, not to bring additional harm. So we have very vulnerable patients that come to Cure, some of them, a lot of them on the verge of death.
Observing patient safety is a big thing to prevent cross-infection from one patient to the other. And some of the practices that we are doing to ensure that is proper hand washing for each and every medical worker.
It's a special day today because we are rolling out quality improvement activities in this hospital, and we have started with the maternity services, Mpeereza Ward to be specific. Over the last 1 year, the quality improvement team has been working with the doctors, the nurses and health workers in Mpeereza Ward to try and improve protocols, standard operating procedures, to come up with these standard operating procedures and put them up.
We look at the care delivery problems where there are active failures, and these are unsafe acts by providers, errors being made. For instance, someone prescribing medication for a different person thinking that the patient he saw yesterday, violations of protocol, not following the right procedures when looking at patients. And this can be actually helped by defense barriers at the workplace, knowing which equipment to use, how they are kept, so that incidents are kept at a minimum.
We've developed protocols that are going to be followed, and it's now easy for us to identify whatever equipment, whatever drug we need in case we get any emergency in maternity ward.
We have started this initiative so as to improve the quality of care in this hospital. We are very passionate about quality of care. Our vision in this hospital is to become a center of excellence for quality care, medical education and research. So quality improvement is key for us in improving the quality of health care that we give to our clients. We are also happy to partner with Uganda Protestant Medical Bureau as one of our very important partners as we walk this journey of quality improvement. We have received assurance that they are going to support us, they are going to partner with us as we see and as we roll this out across the whole hospital.
The main objective is to develop effective interventions and systems in UPMB health facilities that will be able to optimally utilize the locally available resources to reduce the cost burden of adverse events.
But also what is most important is the need to have a safety culture in the workplace, being open, being able to speak up mistakes, being able to share those errors so that other people can learn from them. Because when we share these incidents and work out solutions, how the errors came by, then we have solutions. Those solutions should be spread across departments so that we don't actually repeat the same errors which would harm patients.